World Health Organization. Don't you see the importance of an organization like that to coordinate a global response?
Sure, I do, but not when you're being ripped off like we are by the World Health. World Health ripped us off. Everybody rips off the United States, and that's it. It's not going to happen anymore.
Now, of course, Trump is right, and one of the WHO's priorities is to pass something called the Pandemic Treaty. Well, of course, that's a huge violation of U.S. sovereignty. One of the treaty's main goals will end up stifling free speech. Clearly, that's what they want to do, because some of the early drafts tell you everything you need to know, requiring countries to identify and combat disinformation. Yeah, so basically our whole show would be persona non grata during the pandemic when we talked about masks and the shot and mandates. Joining me now is Dr. Peter McCullough, an internist and cardiologist. All right, Dr. McCullough, you and I would have not been anywhere, right? We wouldn't have been on television from February of 2020 through what, the 2022 under this this draft of the Pandemic Treaty? Of course we shouldn't be there in this nonsense.
The tipping point was the global protests at the World Health Assembly last summer. The entire world is rejecting this international health regulations and pandemic treaty alliance.
Well, you know that people like Bill Gates are very serious about having global surveillance. And when they say surveillance, they mean, you know, reporting of data and so forth. And on the surface, that sounds like that would be fine, correct? But when you get into disinformation and misinformation, I mean, given what Fauci was saying at the early stage of this pandemic with the wet market and masks and social distancing, I mean, all of that turned out to be disinformation.
We need biosurveillance, but we need surveillance of biolabs that are creating gain-of-function dangerous pathogens. So not surveillance on one another. And I tell you, I think the response back from the WHO to Trump said it all. In their letter, they said they've been working on accountability, transparency, and cost effectiveness for 7 years. Well, Laura, they just got a 20% budget cut.
Well, people don't realize this, Dr. McCullough, but the WHO, just from the United States, and we're the biggest funder, $1.28 billion with a B, and they're concerned, Tedros is concerned, head of WHO, that we need health, quote, equity. That's the main focus, too. What does that mean?
The WHO is a global money pit, is what it is. We have plenty of capabilities at the CDC. Our healthcare is not influenced at all by the WHO in the United States.
No, it's absolutely insane. Dr. McCullough, I haven't seen you in a long time. It was great to see you. Thank you for everything you've done on this subject.